In today's Health Watch, more parents are openly speaking out about shrooming, essentially for their mental health. Psychedelics being used as therapeutic alternatives to conventional medicine for depression and anxiety. So what's really happening here? Joining us this morning, Johns Hopkins professor of psychiatry and behavioral sciences, Dr. Matthew Johnson. Good morning.
Good morning.
So before we get into everything else, let's just talk about what it is that these microdoses are actually doing to our brains, to our bodies. What's the impact here?
Yeah, we really don't know much scientifically about this so-called regimen of microdosing, which is taking very, very small amounts of the psychedelic, such as magic mushrooms, on a continual basis. Protocols suggesting things like take it a few times a week, but just sort of, continuously use this. There's really no evidence that some of the claims are true about it helping with depression and ADHD and creativity. It might be true, but there's evidence that at least a good portion of it is placebo effect.
That was my next question, because you're hearing from a lot of parents, and in a lot of cases, moms have come out and said, this helps ease the anxiety a little bit. And I was curious about if there's anything to back that up, or if it, in fact, is it more placebo and more me thinking like, this is going to help, so I feel better about it.
In terms of anxiety, there's actually a little bit of very early evidence I've seen that it increases anxiety a little bit, which shouldn't be surprising because larger doses can certainly increase anxiety quite a bit. And I've seen hundreds of those cases in my research where I give high doses to people in limited 1, 2, or 3 sessions, which is a very different model than this microdosing regimen.
It's interesting, and I'm curious your take on this too, because then the opposite, right, is the negative impacts that could happen, maybe if it's either too large of a dose or too often. What are the limitations here? If you have somebody who is saying, I'm experimenting with the micro doses, what are the dangers?
Yeah, one thing people should keep in mind, despite it being decriminalized in D.C. and some other places, it's still federally Schedule I compound. So some does it, they mention it to their employer, they mention it to there could be legal Child Protective Services theoretically could be called on them, this type of thing. So people should be aware of that. Legality is a risk, whether you like it or not. Also, I have been contacted by a number of folks that say they intended to microdose, and the walls started waving at work, this type of thing. So it's like, oh, whoops, messed up a little bit more than a microdose. And with that risk, certainly anything that about an intoxicating substance, should keep in mind. There's concerns about people driving on it, because the way this is sort of sold is, oh, go about your daily life, not the way we treat high-dose therapeutic work, where the person's monitored, they're laying on a couch all day until the effects are over. This is, go about your daily business. So, you're working on spreadsheets at work, you're watching, your kids, you're driving to work, this type of thing. So caution there. There's certainly a potential risk.
Absolutely, and I'm glad you brought that up, along with the illegality factor, and obviously things for anybody to keep in mind. But can you talk for a minute about when you do the research in the controlled setting? How is this used actually to benefit people, if under a controlled setting?
There's a lot of research growing. It's not FDA approved yet, but a lot of research showing very strong results using magic mushrooms, the compound magic mushrooms, to treat depression, using MDMA or ecstasy to treat PTSD and others. A lot of work with psilocybin, very promising for treating different forms of addiction. But that's, people will need to keep in mind when they read about these results. It's after screening participants for known vulnerabilities like schizophrenia, heart disease, things like this, and after extensive preparation. So after 4 to 8 hours of really getting to know the therapist that will work with them, preparing them for the experience. So the risk-benefit profile that we're seeing in this very promising research is not necessarily at play with anyone using this on their own. So
that brings me to the final question then, as someone who is used to working with this in a controlled setting, and the risks and the potential rewards. If a parent, mom or someone else sees this on TikTok or the news or otherwise and says, I want to try this, what do you say to them?
Well, one could look for the very limited number of clinical trials out there that are examining this. That would be one route to go, but that's a very, very limited option. There's not much out there. But I would just, I don't think criminalizing personal drug use is the right answer. There's all kinds of data, I'd say, to support that position. But people should know the risks that are out there, and that there are risks. So, I would just inform anyone who has an interest to really, sir, I don't encourage any drug use, but if someone's considering it, really look at what's out there in terms of the risks, in terms of the safety factors, and, really think about whether this is the right thing for them, especially in the absence of really any evidence so far that's compelling to suggest that this microdosing way of utilizing psychedelics is really sort of this, miracle, cure-all that sometimes it's portrayed as.
If it's even working, right, which is one of the bottom lines there. Dr. Matthew Johnson is with Johns Hopkins. Thank you so very much for joining us this morning.
You're welcome.
There's information if you'd like to find out a little bit more.